Hey everyone, welcome to the Happy Flosser podcast. My name is Billie. I'm your host. I'm so happy that you're here with me. I really appreciate every moment that you spend listening to the podcast. I hope that these episodes are incredibly helpful for you, even if it's not for learning something, dental hygiene, knowing that you have something or someone in your corner that you can rely on. Okay. And today's takeaway, I'm hoping that I can teach you how eruption patterns help you estimate the age of your patient on a high stakes exam or when you're in the clinical setting, but even more importantly, when you get to your board exams. And just there's a couple really like simple cues and examples that we can kind of go over today that will, I think, help you with not just memorization, but really building confidence for you so that you can say, oh, I can see this pattern in my patients. I can see this pattern of eruption when I'm looking at the Panorex. I think I understand this. So if you've ever started and to try to learn eruption dates and you're staring at an eruption chart and you feel your brain like fog over, I just want you to know you're not alone. I want you to know that eruption charts can feel really overwhelming at first because first you're trying to learn the difference between the permanent and the primary dentition, and everything's kind of happening all at the same time in that mixed dentition. So it can be a little bit kind of crazy, actually. So I'm going to show you how eruption patterns actually work. And I do have that phone number to memorize. A lot of students, I posted on TikTok just a short reel using my eruption phone number, and a lot of students reached out and they shared that they struggle with this, and that's what prompted the development of this episode, right? So you can estimate age confidently on exams and in clinic long after you forget the phone number if you start by learning the pattern first. So I just want you to know, you guys all love that. So I'm like, okay, this is what you guys need. I promise you that if you not just learn that, memorize that phone number, because we know memorization doesn't stick for a long time. I want you to really think about the patterns because the pattern will stay with you your whole career, right? We know that this stuff is on your board exam. So the clinical portion, that computer portion of your 8X exam, there's Panorexes on there, and they ask you specifically how old is this patient. So you're going to be exposed to eruption timing questions. You're going to be exposed to mixed dentition identification, and you're going to be exposed to pediatric case studies. So all of these things will be coming your way. So this is important and very relevant. And in the clinic, it's a lot easier for you to chart your patient, provide that education that your patient needs, and identify those developmental delays that can exist with our patients. So you are on the front lines of all of this stuff. Knowing those eruption patterns might be the easiest way for you to feel confident when you are working with patients with those situations and those needs. All right, so let's go over the core patterns, and we'll start with the primary teeth. So I do have a reel on my TikTok that says cute little frogs can't swim. Shout out to Kelly Goey. Cute little frogs can't swim. Centrals, laterals, first molars, canines, second molars. That is the core sequence pattern of the primary dentition. There's other ways that you can build like little acronyms to remember, right? But I loved the cute little frogs can't swim. I think that's adorable. So centrals, laterals, first molars, canines, second molars. And honestly, she helped me remember that because I never had made any kind of like jingle or way to remember it. I just, just the patterns there, memorization, and you move on. For the permanent teeth, the important thing to know in the pattern is that the first molars and those lower central incisors kick it off. So here's the clinical application here. If you have a patient in your chair that's a little tyke, right? A little guy, and they're with their parent and they haven't had any of their permanent teeth come in, that would be a great educational piece to share with the parents. Hey, I just want to let you know, when you start seeing those little lower anterior teeth come in, that is our sure sign that the first molars are erupting in the back. Those are the first big molars that they get, and those are permanent teeth. That is one of the most valuable pieces of information you can provide a parent. Otherwise, they don't necessarily realize or recognize that those teeth are there because you don't lose a primary tooth to get it. It comes in posterior to the primary dentition. So great education for the parent to let them know that. So those first molars and the lower incisors kick it off. And then all the incisors fill in. Just like the primary dentition, the canines come late. The premolars come before the canines, with the exception of that mandibular second premolar. And then the second molars come in around 12 years of age. Guys, the wisdom teeth, they come in whenever they feel like it. So don't like nail down on worrying about the wisdom teeth, right? You don't need every number right here. This pattern is about learning the order. So don't get yourself in the weeds yet. We'll cover that in a minute. So what I want you to be doing is understanding how the pattern will help you estimate the age using those eruption patterns. So here's a couple steps you need to do in order for that to be successful for you. If you're looking at a Panorex, let's just use a Panorex as an example. I did put a reel on there on my TikTok that had a picture of a Panorex. And on that Panorex, I said simply, how old is this patient? To really get you guys thinking about this. And that really sparked a lot of questions too, which stimulated the creation of this episode. So it's not just about memorization. Let's apply this in the clinical setting. And what does that look like? So step one, if they have all, you're going to identify the stage your patient is at, right? If they have all their primary teeth, you know they're under 6 years of age. If they have a mixed dentition where they have some primary teeth, some permanent teeth in their mouth, you know they're between 6 and 12 years of age. And if they have no primary teeth left and they have all permanent teeth minus the wisdom teeth, you know that they are at least 12. And I know this is generalized, so just roll with me here, okay? Step two, I want you to look for those anchor teeth. If the first molars are present, that patient is at least 6 years of age. If the premolars are present, you know that they are at least 10 years of age. If the canines are erupted, you know that they are around 11 or 12. And if the second molars are present, you know that they are 12 years of age or older, right? That is like around, right? So we're guesstimating based on the patterns, which is incredibly helpful when you're trying to answer a question or figure that out. So step three, now let's just narrow that range down because you guys know if you've taken any exams with eruption pattern questions, they dial it down into a very specific age range. So when you're looking for those anchors, it helps you kind of narrow it down, but it might not give you the exact right question, the exact right answer for your question. So you need to narrow the range a little bit. So what I mean by that is look for these combination things. Like if they have the lower centrals and the first molars, you know they're 6 or 7, right? They're not 6, they're 6 to 7 years of age if they've got both of those in there. If they have the premolars but no canines, right? You know that they're between 10 to 11 years of age. And if they have the canines and the second molars, you know that we're up around 12 or 13. So sometimes when you know the pattern and then you can combine different teeth together, narrowing that range, it's going to help you really kind of dial it in and figure it out. So let's just go through like a couple of examples of like, what does this look like on an exam? What does this look like in the clinical setting? So remember, I told you step one, figure out what dentition period they're in so that you can try to figure out how old they are. If you have a mixed dentition and they have the first molars and incisors, this is a classic 7-year-old mouth. Like this is classic. If the patient has the premolars erupted, but the canines are not in yet, they are around 10 to 11. If they have the permanent dentition except the thirds, they're at least 12. And if it's the primary dentition only, like I said, they're under 6. But let me tell you some of the common mistakes students make, because you can do this in under 10 seconds once you learn the anchors that go together. Okay. I want you to really dial in on the patterns. And I know I have the phone number for those memorization for the numbers, but the understanding is at a different level of learning than the memorization. We know that memorization is short-term learning, right? Pattern recognition develops that deeper understanding that you're going to need throughout your whole career. So I don't want you to just memorize the number. I want you to learn the pattern, and then the phone number will make everything make sense because it follows the pattern. The other thing that common mistakes students make is they forget that the mandibular teeth erupt first. And sometimes there's little clues on that Panorex where you're looking at those mandibular teeth. And then if you know the maxillary teeth are in that pattern recognition, that the patient's just a tad bit older. All right, so think about that. The other common mistake that students make is they mix up the premolars versus the primary molars. So take your time there, looking to, because maybe there's on that Panorex, maybe there is a congenitally missing premolar. We know that's very common with the mandibular seconds. So make sure you realize that they're still in the mixed dentition phase. So don't let that one be like a distractor for you. And you guys tend to overthink it sometimes. So don't ignore those big clues. And I tell students to look at those mandibular canines. Don't underestimate the value of those. The mandibular canines come in between 9 and 10. And so you can really decipher between that really strange, awkward, ugly duckling stage of those patients because they'll have the incisors in and they may have a premolar, like an odd premolar erupting in there. You don't know, right? You don't know all because they're all over the place. Or maybe the premolars, the primary molars haven't quite exfoliated yet. And so sometimes those mandibular canines are great little guys to take a look at after you've noticed the pattern and you've kind of looked at your anchor teeth to figure it out. Sometimes those will give you that further confidence to figure out the exact age of your patient. All right. You guys already know more than you realize. And what's cool about the eruption patterns is that your brain loves patterns. So let that work to your advantage. You want to learn this information in a way that you can use it for the long term in the clinical setting. You do not want to just memorize for a test that you have next week or this semester. Right? Let your brain use those patterns to work for you in the long term. So it's not about memorization, guys. It's about developing, analyzing, and developing that understanding. And that's honestly what makes dental hygiene school challenging. It kind of adds another layer to the challenge of the content because you know that this is stuff that you want to have available in your brain when you're dealing with patients and questions that patients have and things that they ask you. So I totally get that. But I tell you, every time you practice those eruption patterns, you are strengthening your clinical muscle skills. Okay, that's going to go a long way at building confidence when a parent asks you a question or when a patient says, "Is this normal?" Those are the types of things that will really help you by knowing those patterns. And then the other thing it does, by leaning in on learning those patterns, I want you to realize that that's going to help your brain learn patterns in other content, in other areas of the profession, because as you go through the program, you start to recognize that all of your classes are kind of interwoven. All right. And I got to tell you guys, you know more than you think. You are stronger than you realize. You're more capable than you think. You're doing amazing work. If you're listening to this podcast to this point, then I know what kind of student you are. You are someone who cares about how you learn. You care about how you show up for your patients. You care about getting those 3 letters after your name. And I care. That's why I keep showing up. So great job for you guys, honestly. I hope this episode was helpful for you. If you guys need anything additional, you can always send me a message. You can follow me on TikTok and reach out to me there. This is why I'm not afraid to come on here and create a podcast episode on content that someone is having trouble with. So sometimes that's where my episodes come from. If that's you, please reach out. I'm happy to create something that works for your brain. All right. Have a great week, guys.